Hey everyone, Hava the Midwife here, and today I'm going to talk about blood pressure. Most everyone has had their blood pressure taken at some time or other, and mostly, if you're pregnant, if you've been pregnant, you had it taken at your prenatal visits. If you've gone to the doctor, they take it, and most of the time they'll put the cuff on your arm, this cuff. They'll put it on your arm, it'll squeeze your arm, and then it will beep, and they'll take it off and they'll say it's great, or they'll say it's high. Or they'll say, wow, it's really low. But either way, most providers and clinicians do not take the time to explain what is blood pressure. Like, what are we actually testing for? What are we testing for, and what's the significance? So as a midwife, I practice a lot of education. Part of what I do at the prenatal visits and the birth and pretty much every other contact time that we have together is I like to explain what we're doing and explain what it is that we're looking for. So one of my favorite things to talk about is blood pressure, because it's one of those things where it's so familiar and yet nobody understands what it's actually, or rarely do they understand what it's actually testing for. So I just wanted to show you. This is a manual blood pressure cuff. And in order to measure blood pressure with a manual cuff, you need a blood pressure cuff and a stethoscope like this. Okay. There are also automatic blood pressure cuffs that you can get online and at stores, and I really like the old-fashioned way. I really like the manual way. I love when I can detect, fetal heart tones or any other things without using technology. It's very gratifying, and I like to be low tech, but I know when to be high tech. What are we checking for when we check blood pressure? So basically, this is going to go around the arm and it's going to squeeze until it gets to a certain pressure. I close the valve, I pump, pump, pump. I make sure the needle goes up above 200, 220, something like that. Then I release the air and the blood pressure cuff then starts to release. At that point, I'm watching the dial, and as the dial is going down, I'm listening in my stethoscope for the sound of the heartbeat. So you're going to hear a bump, bump, bump sound as the needle falls. The first place that you hear the bump sound is the top number, called the systolic number, and the last place that you hear the bump down as it goes down is the diastolic, or lower number. Okay, so you'll have numbers like 100 over 60, or 110 over 70, or 112 over 76, or 128 over 82. You'll have different numbers, and often they kind of correspond. Like, you wouldn't really see 140 over 60. That would be odd. But what's the significance of the numbers? Most people do not understand what it is, and I think it's very interesting, and it also helps to understanding what blood pressure is helps you understand why it's important to test in pregnancy. Okay? So the systolic number is the measure of the pressure inside your blood vessels when your heart is doing its pump. Okay, so if you can imagine that the heart is the pump and all the blood vessels are let's call them hoses, right? The little tubes. So as your heart pumps, it forces blood through these little hoses, all right? Now, the wider the hose, the less resistance that's there as the fluid, or in this case, the blood, moves through these little tubes, the less your heart has to work in order to make blood go through those tubes to pass through. Now, if there's narrowing, or if there's some kind of stress on the system, the heart will have to work really hard to move the blood through the tubes. And so the harder the heart has to work to move that blood, the higher that top number is. Okay? So if there's narrowing of the tube, or if there's some kind of resistance somewhere, the blood pressure, the top number, the systolic number, is going to be higher, which indicates that your heart is working harder in order to pump that blood. Okay. Now the bottom number, the diastolic number, is essentially the pressure on the veins, or on the vessels, we'll call them, the pressure on the vessels when your heart is in between pumps. So pump, that's the top number, and then the moment in between those two pumps is it's like the pressure that remains on the vessel wall when your heart is in between pumps, and that's the diastolic, or lower number. That's a lot of the reason why, well, in my practice, when I take blood pressure on a mom, if the top number is a little bit elevated, I'll think things like, she had coffee this morning, she's a little stressed, she might be hungry. maybe she's uncomfortable, maybe she didn't sleep well, maybe she got in an argument with her kids or something like that. Something sort of passing occurred that would cause the top number to go up. When the bottom number is elevated, it feels a little more like I feel a little more elevated concern for her, because that number is a little harder to make rise and it's a little more indicative of a problem. Let's talk a little bit about high blood pressure in pregnancy. It can be associated with a pregnancy complication called preeclampsia, and in that case the high blood pressure is part of the combination or collection of symptoms, and it indicates a wider problem. Another word for high blood pressure is called hypertension, and hypertension can exist in pregnancy even without preeclampsia. It can still be problematic, and essentially, in a nutshell, what it does is it reduces oxygen flow to the baby, and it reduces nutrient flow to the baby and blood flow to the baby over time, so it can result in smaller babies or stress on the baby system in general. It can cause a whole lot of other problems, but I'm going to try to make a shorter video this time. It's really hard because there's so much information I just want to give over to you all, but I'm going to try to pace myself. And I know it's harder for everyone to watch shorter or watch longer videos. So I'm really trying to, whittle it down to the most important information. But I feel like it's sort of my nature to really explain in detail what I feel you really need to know. So anyway, that's a little bit about blood pressure. A lot of times I'm caring for someone and I'm explaining, yeah, did you know what blood pressure even is? And they're like, well, not really. I mean, I know that it's important, but I don't really know what it is or why it's important. So hopefully that helps you and understand a little bit more about why blood pressure is important and why it's something that we test every time, and a little bit about its significance. So anyway, thanks so much for watching. If you watched this far, I really commend you. Good job. Your attention span gets an A++, and I'll talk to you later.